Introduction. Sigmoidoscopy is a diagnostic procedure performed to examine the lower part of your colon, called the sigmoid colon, using a device called a sigmoidoscope, a flexible tube-like instrument attached to a light source and a tiny camera. Indications. Your doctor may recommend a sigmoidoscopy to diagnose abnormalities within the sigmoid colon, including polyps, ulcers, hemorrhoids, tumors, strictures or narrowing of the colon, diverticula or pouches within the wall of the colon. Sigmoidoscopy may also be indicated to investigate the following conditions: lower abdominal pain, changes in bowel habits, unexplained weight loss, itching sensation around the anus, rectal bleeding or blood in the stools, low blood counts, low iron levels. Preparing for the procedure. You will be given specific instructions regarding preparation for the procedure. In general, you may be asked to follow a clear liquid diet 1 to 2 days before the procedure. Stop eating or drinking anything the night before the procedure. Take a laxative and use an enema to cleanse your bowels 1 to 2 hours before the procedure. Avoid taking any blood-thinning medications as they may increase the risk of bleeding during the procedure. Arrange for someone to drive you home after the procedure. Sigmoidoscopy procedure. The sigmoidoscopy procedure may involve the following steps. You will lie on your side on the procedure table with your knees bent. A lubricated gloved finger may be inserted into your anus to check for any blockage or tenderness. The lubricated sigmoidoscope is gently inserted through the anus and slowly passed into the rectum and sigmoid colon. Air may be fed into the colon to improve visualization. This may cause a slight fullness and cramping sensation, but no pain. The camera at the tip of the sigmoidoscope transmits images to a monitor, so your doctor can study the inside of your sigmoid colon under magnification to locate any abnormalities. Surgical tools may be passed through the sigmoidoscope to remove any polyps present or abnormal tissue. Once the examination is complete, the sigmoidoscope will be slowly withdrawn from the anus. The entire procedure may be completed in 15 to 30 minutes. Post-procedure care. After the procedure, you may experience mild lower abdominal discomfort, but it should not interfere with returning to routine activities soon after the procedure. There may also be slight bleeding or blood in the stools if a polyp has been excised. These symptoms should go away in a few days. Risks. Although a sigmoidoscopy is a very safe procedure, there is a minimal risk of injury to the inner lining of the sigmoid colon, infection, bleeding. You should talk to your doctor regarding your specific risks before undergoing the procedure. Summary. A sigmoidoscopy is done to visually examine the inner lining of your sigmoid colon. It can cause slight discomfort, but is sometimes necessary to accurately diagnose certain diseases, enabling early treatment and better outcomes for the patient.